to stop, but I have to finish this because this information is going to be on the final. Okay, because I will have some questions with this. Okay, so let me finish up 36. Okay, 36 was on the previous video that I showed you guys last week. Okay, so with 36, we have to start at malabsorption diseases, and then we're going to go to the rest of the slides and work it all the way into page 90, slide 99. Okay. Now, with malabsorption diseases, what is the first thing that you think about as far as malabsorption? Not being able to absorb certain nutrients from food. What do you think happens? What do you think could be a cause of this? Number one cause you should probably know. Well, it's there. Say, for example, you eat food, and this is very good example, people that are lactose intolerant that we talked about. When you lack an enzyme, this means that you do not have the enzyme to break down that particular food. When you don't have the enzyme ability to break down a particular food, that means that your body will not be able to absorb that particular nutrient that you're supposed to get from food. Okay? So this can also be not only from enzymes, but sometimes infections can disrupt the GI wall and not cause proper absorption. And they say even radiation. These individuals will have diarrhea, yes, and sometimes they can improperly pass food, meaning that they can just have food just go right through their system without being digested. Okay. Now, celiac sprue or celiac disease, which I'm sure you guys have heard of, this is what we call people that are gluten, allergic to gluten or gluten-containing foods. Okay. Now, in the media, they are portraying that having a gluten-free diet is the healthiest thing, and it is not. Okay, this is only for individuals that have a known gluten allergy. Having a gluten-free diet is not going to make you lose any more weight, okay, or anything. It has nothing to do with that. But these are individuals that actually have an allergy where they don't have in their intestines enough enzymes to digest or break down gluten-containing foods. Now, in the intestines, if you remember, I don't know if you remember this, but the small intestines actually have what is called brush border enzymes. Those brush border enzymes are there to break down certain types of carbohydrate food or our gluten-containing foods. Okay, and so these individuals don't have enough brush border enzymes. Now, the big hoopla about gluten allergy is that studies have shown that these individuals that have celiac disease, it is a possibility for them to go into having intestinal cancer. Okay, so they do link it sometimes to intestinal cancer. So this is one of the reasons why it is a big to-do. Okay, and as you can see, most of the grocery stores now have a lot of gluten aisles and things of that nature. Anyone in here have a gluten allergy? No? Okay. So they usually there's quite a few people that have gluten allergies. Now, the diagnosis here is actually to do a biopsy of the intestines, and they can actually see if they do not have enough brush border enzymes. Or they can do different type of antibody testing to see if these individuals produce antibodies against this type of food. Treatment, do a gluten-free diet, as we know, but then another part of the treatment that is very important. Gluten-containing foods are what types of foods? Say that again. Grains. Pastas, breads, grains, and a whole bunch of other stuff. Okay, so even things that are not just full of grains or carb type foods. Now, what you should understand is that when they have a gluten-free diet, because they are eliminating so much out of their diet, they are also depleting themselves of these vitamins. So it is important to make sure that they supplement with these types of vitamins here. Okay, so the next one is tropical sprue. Tropical sprue, they say this is another malabsorption disease. They feel that it's unknown. I feel that it's a parasitic infection, and I'll explain why. This is definitely located in tropical regions. These individuals do have in their small intestines, they are not able to absorb B12 and folic acid. Okay, which B12 and folic acid, if you know, are very important vitamins. Okay, so that's anything you don't want to play with. So signs and symptoms, they will have severe diarrhea. blood-tinged stool, abdominal distension, bloating, and something called steatorrhea. I don't know if you've heard of steatorrhea, but steatorrhea is fatty stool. Okay, fatty stool. Now what happened here with fat in the stool, I don't know if you went over this in micro. Did you go over fatty stool in micro? No. Okay. Fatty stool is present in most of the times parasitic infections because parasites actually feed on your fat cells. And so when they kind of break down the fat cells, that fat will actually go through your GI tract, giving your stool this fatty appearance. And not to be nasty, but what will happen sometimes if a patient has parasitic infection or fatty stool, they will tell you that the stool comes out and it has like white rings around it or white spots, so it looks like fat, actual fat that comes out. So treatment is antidiarrheal and also prolonged antimicrobial therapy because yes, they do believe it is some sort of microbial agent. I believe it's a parasite. Now the next one here that we're going to talk about is something called dumping syndrome. Dumping syndrome, I do have a story with this one. My dad actually had this. Okay. This is a situation where patients have gastric bypass surgeries, okay? And then what happens is that when they have these gastric bypass surgeries and they go and eat food, the food does not get absorbed or digested properly. And the food just kind of goes straight through, okay? My story with my dad, my parents came over to visit me in August, and he had his surgery in June. They came to visit me in August, and he was on vacation, and just what you normally do on vacation, you want to eat. And he ate everything. Like, it was bad. Like, we went to Vegas, he was at the buffet, I mean, just anything. And, you know, people that have those types of surgery, you know, are supposed to be on a limited, restricted diet. And he just totally went off his diet. So, and what will happen, and I've heard of stories like this with people that have these surgeries. So, people have these gastric surgeries thinking, okay, well, that's going to fix it, I'm going to lose my weight, but I'm still going to eat what I want to eat, but that's not how it works. So what happens is that when they eat food and they try to eat food that they shouldn't be eating, the body is not prepared for that. And so what will happen is they will have pretty much a spike in glucose just for eating that amount of food, but as soon as it gets digested or dumped, this dumping syndrome goes right through, they'll have a really, really decrease in glucose, and they'll put them in an extreme hypoglycemic state. With my dad, his situation, we were at the wineries and he was eating a big pork meal that he shouldn't have been eating. And so, drinking as well too, which was not a good combination. And so he basically went to the bathroom, everything came out, and he really actually was almost about to faint. That's how really severe hypoglycemic state he went into. So, this can happen. So, I explained pretty much just what happened. So again, everything will just get dumped through the intestines, okay? So they will have a rapid elevation in glucose, but then the glucose will drop as soon as it goes right through the GI system, okay? And then they can have all of these types of symptoms here: faint, weak, dizziness, tachycardia, okay, paleness, okay? So all of the signs and symptoms as a person that goes into a hypoglycemic state.
Can it also happen, like dumping syndrome, with gallbladder removal?
Possibly. I don't know. I don't know about gallbladder removal. Possibly if you're eating like fatty foods that you shouldn't be eating. I could see that maybe happening. Although I know someone that had their gallbladder removed and they still eat all types of fatty foods and it didn't bother them. So I think it depends on the individual. So, signs and symptoms, they will have diarrhea. Make sure you understand that, because whatever they're putting in their body is actually going to come right out. Also, a rapid fall in glucose 1 to 3 hours after the meal, meaning that they have what is called a rebound hypoglycemia. They will have hyperglycemia as soon as they eat, but then it will fall rapidly. And that rapid fall is what makes them very ill. Okay. So the way to treat this, they tell them to make sure that they eat small meals throughout the day, because that way it'll balance out or keep the glucose levels at, you know, where it needs to be. And making sure they stay away from carbs and take certain medications and so forth. Now, this is not a, I don't want to call this like a disease or condition, but this is something that can happen after these types of surgeries. Not that it will always happen, but it can. And it's usually a thing that's okay. When it happened with my dad, we didn't take him to the hospital. He just sat down and got some water, and he was able to get himself back together again. So, now, the next one is short bowel syndrome. This particular one is when a person has a surgery that actually takes out their small intestine. So whatever situation, maybe a tumor or whatever it is, where they have to take out their small intestines. Now, if you take out your small intestines, what would be an issue here? Definitely absorption, because everything gets absorbed in the small intestines with the exception of aspirin and some alcohol, okay? But everything else gets absorbed in the intestines. All your vitamins, all your minerals, everything gets absorbed there. So as you can imagine, these individuals for treatment will have to have temporary or indefinite intravenous nutritional support, okay? Because if they don't have a small intestine, and obviously depending on how much of their small intestines is removed, that's a major, major thing. Okay, I don't know how many surgeries they do with that, but that's not a good thing. Okay, now with the cancers, it's not a big deal. Most of this you already know. Now, we've talked about esophageal cancer already when we talked about Barrett's esophagus, okay? So please make sure you remember that Barrett's esophagus, and I talked about this in the last video, that Barrett's esophagus can lead to a person having esophageal cancer, because we know that Barrett's esophagus is a form of a metaplasia, okay? So just make sure you know that. There's also some other risks to cancers, genetic, okay, environmental, we know smoking, yes, all that. Now, another thing I want you to know about esophageal cancer is that the prognosis is very poor. And because of the area of the esophagus and the type of epithelium it is, it has a very high degree of metastasis. So it can pretty much spread and metastasize very rapidly. And the treatment is there. Gastric carcinoma, they say there is a high incidence in Japan. I'm not quite sure why. I don't know if it has to do with the diet or what it is. But they say that gastric carcinoma is actually have a risk factor, or one of the causes is the H. pylori infection. So just to help you out for test purposes, and just so you'll understand, H. pylori is one of the causes for gastritis, gastric ulcer, and gastric carcinoma. Okay, so H. pylori is going to be a cause for gastritis, gastric ulcers, also known as peptic ulcers, and gastric carcinoma. And I actually saw that in the NCLEX book, okay, that H. pylori with all of that. So just make sure you know the risk factors, okay, because I can test you on that information. That's a picture that's not so good. Okay. Now, intestinal neoplasias, sometimes they can be benign or malignant. These are not common, but just to let you know, people can have them. And all they do is, if they see the tumor, they'll just remove it, and that's that. Now, colonic polyps. These are actually more common, as you know, okay? So people can have polyps in the colon. Just because a person has colonic polyps does not necessarily mean that they're going to have colon cancer. It's a possibility, but that doesn't mean that they're going to have it. Sometimes people do just have colonic polyps, and that's that. Okay, so they can be benign or malignant. This is a very nice picture of a colonic polyp. And then obviously, if that polyp is there in the GI tract, and as you can see, because of the size, it can disrupt, obviously, the area and flow. So, colon cancer. They say that this can happen after 40, high-fat, low-fiber diet. Please keep in mind that people that do have chronic polyps, and if they look at the polyp and tell that the tissue is, say, maybe a metaplasia in its area of a dysplasia, that yes, this is now considered precancerous, and yes, these individuals could lead to colon cancer. Okay. I felt like there was something else I wanted to say about colon. Okay. Warning signs. Now, you can read this at home, but let me just tell you the warning sign of cancer is a change in bowel habits. Now, colon cancer is usually recognized like at a later age in life. So as adults, we pretty much know our bowel habits, okay? So you know when you normally go to the bathroom. So what's going to happen with these individuals, they may have an urgency all of a sudden. They may wake up with rectal fullness. They may have constipation, diarrhea. Everything is just going to get wacky. Another thing is when they do go to the bathroom, the stool is going to be very dark. Black, tarry, and not only that, only pencil-shaped stool. Okay, so that's also another warning sign. Please make sure you know this. Another warning sign, I know someone that had colon cancer, is back pain. Because what will happen, because of that region, they'll have very lower back pain right around like the lumbosacral area. Okay, so prognosis, early detection is better, as you know. Same situation, just like any other cancer, you have to grade it and stage it, and that all depends on the treatment. Not concerned so much about this, but treatment can be any of this, okay? The person I know that had colon cancer, he actually had chemo first, radiation, they did surgery, and then they went back and did radiation again, just to make sure they got any undetected cells. So they will do a combination, and there's no protocol. It all depends on how the cancer is behaving, okay? So, I'm done. You happy? Now, I do have to review. I'm going to sit down for the review, if you don't mind. Let me see if I have this memory. The final will be 100 questions. Multiple choice. We will have some NCLEX style questions. Okay, so yes, we will have some of the multiples. I will have pictures, labs, and I think that was it as far as extra stuff. Okay. We don't have to worry about the heart sounds, but I will ask you for the description, okay, of the heart murmurs. Okay, but we won't have actual sounds. So that's that. Now, the chapters are, let me see if I can remember them all. 1, 4, 7, 10, 11, 12, 14, is it 14, 15, 16, or 14, 16, 17? 14, 16, 17? I think so. 15, 16. Is it? I'm sorry, let me just get this under control. 14, 16, 17. Oh, no. It's so many. I know, it's a lot. It is 14, 15, 16. Okay. 14, 15, 16. We did 18 and 20. And then we also did 22, 23, 31, 33 today, 36, and 41. Am I missing anything?
I think you need to take off a few. Too many.
And believe it or not, it was supposed to be more than that. Okay. I think that was it. Yeah, I think that's it. Okay. So, let me start with chapter 1. Okay, now I'm going to try to go through this in an efficient manner, so I'm not going to go through each and every topic. Okay, I'm not going to lecture again. But just to give you an overview for each chapter, okay, what you should be focusing on. Now for chapter 1, keep in mind that chapter had just plain type of terminology, okay, medical terms. So the only two things I want you to really focus on with that is making sure you know the difference between a sign and a symptom, and making sure you understand the difference between a subjective and an objective finding. Now, the etiology, pathogenesis, clinical signs and symptoms, and treatment, you guys know that already. You know what it is, okay? So, I could give you maybe a case study or a scenario and ask you to pick out what part of it is the pathogenesis, or what part of it is the subjective finding, what part of it is the sign, what's the symptom, okay? So just keep that in mind. That's how that could be used. And that's basically it for one, okay? Chapter 4, please make sure you know all of the information about reversible and irreversible cell injury. So everything that there is to know about reversible and irreversible cell injury. Make sure you know all of these cellular adaptations. Know not only the function, but make sure you know examples. Okay, and we do have some pictures with some of them as well. Okay, so we have pictures that are posted on eCollege. Now, let me give you an example, because we have some diseases that we've gone over in chapters 23 and so forth, and 22, that had different cellular adaptations. So say, for example, asthma. What type of cellular adaptation occurs in asthma? Hyperplasia, very good, of what? Goblet cells, okay? So things like that is what I'm going to look for. There are certain types of hyperplasia. There are certain hypertrophies that go on. Certain diseases have metaplasias. So when you're studying, I will tell you to please highlight and just make sure you understand which one has the cellular adaptation, because that's how I could pretty much ask you questions, something like that. Okay. So everything with 4 pretty much has a lot of pictures with it too, so make sure you go over all the pictures, know what they are, and examples. Okay, so that's easy enough. Chapter 7, Neoplasia. With this chapter, I went over with you everything that there is to know about benign and malignant tumors. So please make sure you know the differentiation between the two. Make sure you also go over the nomenclature. There is a table in your book. I think it's table 7.2 or 7.3, something like that. So make sure you review the table on nomenclature, just in case if I have a question about a different cancer that we haven't gone over. In this chapter, I also talked about risk factors, so make sure you go through all the risk factors, and make sure you go through grading and staging, and anything that has to do with a complication of a cancer that we talked about, like the pain, the weight loss, and all the effects of cancer. Oh, and also warning signs. We did go over warning signs of cancer in adults and children. Okay, so that was week 1. Okay. That was week 1. Now, let me say this before I forget. A lot of people say, oh, are you going to put more questions from after the midterm and so forth? To be honest, I try to do that, but it's difficult because a lot of the bulk of the information, if you look at the chapters, are respiratory, cardiac, and blood. Okay, so most likely there are going to be a lot of cardiac questions, a lot of respiratory questions, but I'll try my best to make it even. Okay, but the exam is cumulative for the whole term, so it's not just after midterm. Okay. Now, week 2, we did 10, 11, and 12. So for week 2 with 10, we only went over the 4 different types of hypersensitivity. So I will tell you to please review that. I would tell you to utilize your textbook for this information. Please make sure you know what the different types of hypersensitivity are and examples, because that's pretty much how the questions are going to be. Probably an example of what's going on with this particular patient and what type of hypersensitivity it is. We also did chapter 11. Chapter 11, nothing to say about this other than study everything, because this chapter was laid out very nicely for you with all the leukemias. Please make sure you pay attention to all the hallmarks, because I think that is what's going to help you answer the questions. I remember this test and a lot of people had issues with it. So make sure you pay attention to some of the common signs and symptoms that these leukemias do share. So the ones that have fever, there's like maybe 2 or 3 that have fever. Some have night sweats, some don't. Some have bone pain, some don't. So just make sure you try to put them in a category. And for those of you who came to tutoring, I think I don't know who was here, and I kind of laid it out all on the chart for you. Okay, so try to make up a chart format like that so it'll make it easier. There's also pictures with this. Okay, so just make sure you review the pictures. 12. 12 was HIV and AIDS, and with this chapter is pretty easy. All you need to do is just make sure you understand modes of transmission and prevention. Make sure you also know the CD4 categories, the CD4 count categories. And also with the CD4 count categories, make sure you understand what types of diseases are seen in those categories. Okay, so there's certain diseases that you'll find. And please, please, please make sure that you go over the diseases that are considered AIDS-related diseases. Okay, and that's also in that chapter. So there's certain diseases that are just recognized in AIDS-related patients. I will have let me just say, also make sure you go over the 3 types of testing that we talked about. Please keep in mind for this chapter, most of those questions will definitely be NCLEX-style questions, because it's how would you manage a patient, how would you talk to them, how would you explain the testing type, how would you explain their exposure, okay, things of that nature. So even though you read this information and memorize it, try to put it in a clinical format, okay, somehow. So that was week 2. Week 3, we went over chapter 14, 15, 16. 14, 16, 17. 14, let me just confirm. 14, 15, 16. That's what we did week 3. I have that in my binder because I was trying to do good with making up my lesson plans. Okay, so no, it's definitely 14, 15, 16 for week 3. So for chapter 14, please make sure you know the flow of blood, not the flow of blood. Make sure you know blood coagulation, the whole blood coagulation cascade. Please make sure you know what happens in it, okay? Also, make sure you know the difference between heparin and coumadin. Make sure you also know how to assess a patient that may have a blood clotting disorder, okay? And they talk about that in the PowerPoint. So, assessment. What types of questions would you ask them? Okay, if they're on aspirin, do they have liver diseases? Okay, so make sure you go through the evaluation. Also, laboratory tests. I think on here I gave you bleeding time. Okay, so make sure you know the laboratory tests that are associated with this. Oh, that's what I forgot to go over. And then after that, There are some pictures that are associated with this, so a lot of the bleeding, you know, conditions on the skin. And then just make sure you go over all the diseases in that chapter. Okay. I don't know which one I'll use. Now, another thing while I'm thinking about this, a lot of people ask, oh, are you going to repeat questions? Yes, I will repeat questions, the ones that most people got wrong. So if I look through and see that a lot of people, a high percentage of people didn't understand this question or didn't get it, I want you to get it so I could repeat that question. But I don't want you to study your old exams. Now, the purpose of also doing those exams on eCollege is so you guys can have it available. Okay, whenever you like, you can go on eCollege, look at your old tests, see what you got wrong. Please study the concept and don't study the question. Because I had students that study questions that, oh, well, this question was this, and they answer according to what they studied the question. Don't do that. Study the concept, because what's going to happen is I can use that same concept and flip the question around. Okay, so just wanted to give you a heads up with that. In eCollege, I believe all your tests are open, so you should be able to go back in and look through all of them. If you can't do it, just let me know and I'll just double check. Okay. So, chapter 15. Chapter 15 was easy because we only talked about a few things. Okay, so it wasn't nothing major. So the things that we talked about was definitely DVT. We talked about varicose veins. We talked about aneurysms. We also talked about Buerger's disease and Raynaud's disease. Okay, so Buerger's disease and Raynaud's disease, or Raynaud syndrome. Okay. And I think that was it. Now, those are the diseases that we gone over. Now, with chapter 15, that's not to say, please make sure you review what happens if blood is stasis in a vein, or if it's stasis in the artery, so you'll know what types of symptoms come from that. So please make sure you go over just some of the alterations in blood flow. Okay, so I don't want you to just study those diseases and that's it. Okay, so that was 15. 16 was blood pressure. And so with blood pressure, I do need you to know the different types of measurements of blood pressure. And the other thing is that normal physiology, short and long-term regulation of blood pressure. So please make sure you go over short and long-term regulation of blood pressure. And then please make sure you know everything there is to know about hypertension. Okay, even primary and secondary. And most of the chapter is about hypertension. So please go over everything, the different types. I do want you guys to also please make sure you know the blood pressure classification, and that's table 16-2. That's in your book, so those are the blood pressure ranges that you memorized. Okay, so that's 16-2. So everything that there is to know about blood pressure, risk factors, okay, even end organ damage, okay, what other types of conditions that people can have with hypertension, so everything. Okay, so that was week 3. Uh-oh, did that shut off? Is it still going?
It looks to be.
It's going?
Yeah, the camera's on.
Oh, okay. Okay, so that was week 3. Week 4, we only did 18 and 20 because that was the week. Oh, no, that wasn't the week. Okay, no, we just did 18 and 20. 18 was kind of jam-packed, if you can remember. Okay, so for chapter 18, we went over arthrosclerosis, so make sure you know everything there is to know about arthrosclerosis. Even the pathophysiology we went over in detail. Make sure you know everything there is to know about coronary artery disease. So remember, we went over the acute coronary syndrome. And what do you remember from the acute coronary syndrome? There's 2 things that determines what type of MI.
Oh, the not CD4, but the enzymes that are...
The enzymes, or let's just say, not so much but the biomarkers, or cardiac markers. And what else do you look for? The ST elevation, very good, on an EKG. Okay, so make sure that you go through what happens in that acute coronary syndrome. Okay, and all of that is laid out for you. Make sure you also go over the different types of angina. And then the next thing we went over was all the different valvular diseases. So make sure you go through all the valvular diseases. Now, for the valvular diseases, make sure you understand what's going on in the heart, but not only just what's going on in the heart, but just make sure you understand also the description of the sound. I will test you on the description of the sound, but I will use exactly what's in your PowerPoint, okay? So I'm not going to say rumbling, humming, you know, crazy noises, but I will use the exact terminology in the PowerPoint. We also went over with that chapter some itises. So endocarditis, myocarditis, I would go over, rheumatic heart disease. And we also went over some cardiomyopathies. Okay, so that was 18. 20 is not too bad, okay, because 20 we only went over in detail a few shocks, okay, so it wasn't too much. In the beginning, I did go over the pathogenesis of shock, so I would say please review that. But as far as the different types of shock, I'm just going to list the ones that we went over in detail. We went over, no, I'm sorry, before I say that, I do need you to know the categories of shock, and then there's some, so I'll tell you the box. Box 20-1, I do need you to know that box. Box 20-1. So for the shocks, we have cardiogenic shock, we have obstructive shock, we have hypovolemic, anaphylactic, and septic shock. Okay, so those are the only shocks. And I do want you to also go over the complications of shock, which were the last couple of slides on that page. So understand, if you have a question about a person that has a shock, and if they can they have a complication, yes, they can have complications of shock. Okay, so just make sure you go through that. Okay, so that was week 4. Week 5 was your midterm week, and on that week, okay, on that week, we only did 22, which was very easy. So the only diseases we went over that week was asthma for 22. We just did asthma, acute and chronic bronchitis, and emphysema. Now, what could I pinpoint from this? Not really anything, but just please make sure you go over each and everything. Pay attention, close attention to obviously signs and symptoms, laboratory testing. We didn't have many pictures with chapter 22. I think there's maybe 1 or 2, if any. But just kind of review everything. And I think I did tell you some hallmarks, certain things that stick out. So pay attention to those hallmarks. So that was week 5. Week 6, which was last week, the week that I was absent, that you guys have the video for, was chapter 23, and I did chapter 23, I believe, almost in its entirety, with the exception of neuromuscular diseases. So for chapter 23, we did slides 1 through 1 through 96. Slides 1 through 96. So you are responsible for all of that information. Okay. What could I pinpoint from it? Make sure you pay attention. This particular chapter actually had more pictures. So make sure you pay attention to the pictures that go with this chapter. Pay attention to the laboratory testing, any clinical signs and symptoms. So there are things that stick out with this chapter. Okay. So pay attention to the hallmarks that I went over. Also last week, week 6, the week that I was out, I did chapter 36. Okay, most of it and the rest of it I finished up today. With 36 is pretty easy. Once we get past cardiovascular, it gets a little easier. Okay, so cardiovascular and respiratory. 36 GI disorders are very easy. Okay, so all you really need to pay attention to is what is the disease, what's going on with the disease. Most of them have the same signs and symptoms. They're either constipated or diarrhea or whatever. It's the same, pretty much same thing. So they're not that difficult. Okay, so it's nothing really to pinpoint, but just make sure you study it all. Okay. 36 doesn't have any pictures, from my knowledge. I don't think it has any pictures, so you don't have to worry about that. Today I did 31, 33, and 41, diabetes. 31 and 33, just please review all of the slides that I went over with you today. That information, those test questions again, because I didn't go into a lot of detail with it, but it will be pretty much straight from what I just went over with you in the PowerPoints. And with 41, it's going to be definitely just making sure you know the difference between the two types of diabetes, okay, and how clinical manifestations and also management. 33, I'm going to have pictures. So I will maybe put a picture of a uterine prolapse, maybe a retrocele, cystocele, maybe a picture of uterine displacements. Okay, so make sure you just kind of review that information. So that's it for the chapters. Let me just go over and make sure you have the right laboratory values that you need for the test. Okay, because some of these questions will have labs with them. So for your laboratory clinical reference guide on the first page, you should have highlighted platelet count. You should also have highlighted red blood cell count. You should also have highlighted white blood cell count, whole blood, and then white blood cell differential. Okay, so just make sure you have all of that. The next page we took a look at, excuse me, was page 488. Excuse me. Page 488, I need you to know the whole lipid panel. Okay, so we highlighted the whole lipid panel. I am concerned about the desirable amount. Okay, so I don't want to get you too caught up with borderline and all that, high risk. But make sure you go over the desirable amount with that. Page 489, at the top we had cardiac markers. So with cardiac markers, keep in mind you had the creatine kinase MB, and troponin. Also on this page we have our blood clotting assessment that I told you to highlight, and then what I just gave you today with the glucose testing. Okay, so, and I think that's it. So that's it for the review. I will have tutoring again this Thursday from 1 to 3 and tutoring again next Thursday from 1 to 3. Now, so you will have 2 tutoring sessions that are available for you before the final. If for some reason Thursday does not work out for you, please let me know. and I can try to do possibly a Friday morning, which is a little iffy, or Monday, but we'll work it out. Okay. Now, what I'm going to do for the rest of the time, if you guys need to sit and talk with me, if you're missing any assignments, if you are on e-college and something's wrong with your grade or something's goofy, if you need to talk to me about your presentation that's due next week, let's try to settle all that stuff right now. I'm going to stay here now. I have somebody's paper I'm going to read over. Okay, so let's utilize the time for that. I'm sorry, say that again.
Can we take a look at our quiz from last week?
Your
The quiz from last week, are we able to take a